if you're ready, we'll get started, and we'll.
I am ready to rock and roll.
Um, so, one, I want to welcome everybody. Thank you for joining our beginning series of doc talks, and really we started these for two primary purposes. One is for current users. So there's some questions about how to use and things that the people have had that we'll get into. And then also they're for people that are just questioning the device. Obviously, one of the struggles we have is the way we're mostly selling today, although we're starting to go straight to doctors now, is through social media. And when we completely understand that you can be labeled gimmicky. And I think one thing, that's a challenge. So we're going to come back to that. Today, for our doc talk, I am thrilled to have a guy that I've worked with a long time. Dr. Michael Breus is a sleep doctor, but more important than that, he is the sleep doctor, and he can go through that. And Michael has been on Dr. Oz, The Doctors, Rachel Ray, dozens of times, each of those. He has a new book coming out that I'll let him introduce. So Michael, let you introduce yourself.
Well, thank you so much, David, for that awesome introduction. So just to let everybody know, David and I have worked together in many different roles. I have tremendous respect for everything that he's been doing. And I was fortunate enough for him to ask me to come in and start looking at and being part of SinuSonic. So number one, thanks, David. I really appreciate it. And I'll tell you why I appreciate it is because it's actually a true innovation in sinus care. And it's something that I have personally found to be effective for me because I do not have great sinuses to begin with, as well as I've found it to be incredibly helpful for several of my patients. And I'd love to just kind of break that down a little bit and tell you about my personal experience, if that's okay, and then tell you a little bit more about what I've seen with patients.
Yeah, that'd be great.
So first of all, David came to me with this idea, David and actually his partner, Dr. Rick Bogan. And Dr. Bogan and I have been friends for like ever. And just so that you all know, Dr. Bogan is one of the preeminent sleep specialists in the world. He started a very large sleep laboratory company that has been incredibly successful that I was very fortunate to work with early on. But one of the things about Dr. Bogan that I always admired was he's a problem solver. Right? So every time we would find something going on, either in his business or something, he'd be like, Michael, I've got an idea of a way to solve that problem. And he never got upset about it. He just would work his way through it until he figured it out. So it doesn't surprise me that the story of where SinuSonic comes from came from a night when he was trying to solve a problem for himself. So he woke up in the middle of the night, hyper congested, having difficulty breathing and being able to get back to sleep. And so what did he do? He did one of those, you know, those when you're on the airplane and you want to pop your ears type of deals, right? So my understanding is he did want to, you know, and popped his ears while he was humming. And that turns out to be a very important aspect of this. While he was humming turned out to be very, very important. Yep. And he was telling me this story. I was like, hold on a second. So you're holding and you're humming and you're doing all this crazy stuff. I said, well, what happened? He said, almost immediately, like within 30 to 60 seconds, my sinuses cleared, right? And I was like, okay, that's interesting to me because I have patients who have terrible sinus infections, snore like freight trains, and even more importantly, they cannot utilize their CPAP equipment in a way, shape, and form that is effective for them because they've got so much damn nasal congestion going on here. And so I was like, I am all ears, dude. Tell me what's going on. And so he produced actually a product. So I want to show this to you because I actually feel it's quite remarkable. It comes in this handy dandy bag here. And this is mine, by the way. So this is the one that I actually use, okay? And so let me explain to you my routine. So every single morning when I wake up in the morning, after I brush my teeth, I use this. Now, I'm gonna tell you something. This is important for people to understand is you have to use the device for it to work, okay? You can't just take off your glasses and decide to breathe a couple of times and hope for the best, okay? That is not how this works. There's a protocol, and if you follow it, it will work, right? So let me explain to you what the protocol is. And I'm gonna do this as a side view so you can kind of see me in action, if you will. So you place it over your nose, making sure that you get a seal around your lip as well as the top of your nose. When I will be breathing in, and then when I breathe out, I want you to listen. You're going to hear a flutter, right? That's a little ball that's up here that's making a little fluttering noise. That is key because you have to push pressure against it. And then this device does the humming for you. So when I'm pushing out and breathing in, pushing out and breathing in, and there's a nice little alarm here that will tell me when I'm done. So you should do it for approximately 2 minutes or so. So this is what I do every morning. My wife looks at me like I'm crazy until she realizes that I can now breathe, right? So I know it looks a little goofy, but trust me on this one, it works. So here's what you would do is you place it here. You hear that fluttering? Can you hear that fluttering on that side?
Yep.
That is the key factor, is to make sure that you flutter with it. And so here's what I do. So I live in California, and I'm kind of one of those kooky Californians who likes to do things like breath work and meditation and all these things. You can't do either one of those with a stuffed up nose. So every single morning, I do this after I brush my teeth. Then I come downstairs and I actually do breath work and then my meditation. So for folks out there who are trying to get to another level with their health, with their mental health, with their physical health, breathing turns out to be critical, not just for life, but for a whole host of other options out there. And so I want everybody to know and understand that you can incorporate this into your life in a lifestyle way that is very simple. I literally have one of these that sits on my sink in the morning, and I use it then, and I use it the same one at night before I go to bed. Again, 2 minutes in the evening. Now you might be saying, well, wait a second. Well, I mean, I thought you cleared your nose out in the beginning of the day, Michael. What's going on in the end of the day? So let's talk about that for a second. Walking around all day, I got to be honest with you. My house is pretty clean, but let me tell you something. I got a French bulldog. I got a cat. I got 2 kids. I got particulates flying everywhere, right? I've got flowers outside because we enjoy that type of agriculture. So we've got pollen in our house. We got all kinds of things going on. Not that anybody out there has an unclean home, because you don't, but stuff just comes in. So it's going to get up into your nasal area. And one of the most important things I tell people is sometimes people will say to me, Dr. Breus, I got this big thing underneath my nose called my mouth. I can breathe through that. I don't really have to worry too much about my nose. That is a bad idea, okay? And I'm going to explain to you why. So you know how our cars, we use unleaded gasoline, right? That means it's filtered, it's got primer in it, and it's going to work in our engine. But leaded gasoline, you have to actually have a different engine for it because it's unfiltered, right? When you're breathing through your mouth, it's unfiltered or leaded gas, if you will, okay? And then when you're breathing through your nose, remember, that's a filter, right? So we've got tissue in there that keeps it warm, keeps it moist, filters out all of the bad stuff. So that's the unleaded gas going through your nose. So Michael, why do you use this at night before bed? I'll tell you why, is because I want unleaded, in my fuel system, not leaded through my mouth. So that's one of the reasons that I do it. Now, I'm going to move over to the patient side of things for a second, if that's okay, David. I'm kind of on my soapbox and going crazy, if that's all right.
So let me keep those thoughts, but
I will.
Because you're hitting exactly on a couple things. I've got some sleep questions, and there's some coming in too. So we're going to go some
good
sleep things. But to the idea of these doc talks originally were these sort of two. One is, I've got one now. How should I use it? And
right.
you've been talking about some of that. No question about it. What you mentioned, and I've been sort of talking about it now. It's an exercise for your sinuses.
Absolutely.
You have to do. Your point is you have to do it, but you don't just kind of put it to your nose. It's not magical. So,
wouldn't that be great if it was magical? Man, we would sell a ton of these.
Yeah, so that would be fantastic. But what we know though from one of the things that's frustrating with a new product is our Amazon reviews. So many of them are, I got it, did nothing for me. And the issue, we get back those returns from Amazon, and we can download, we can't track you, and we don't have a camera in there, we're not those, but we can see usage information.
Right.
And the returns aren't used. I mean, they pulled the tab to open them, they fiddled with it, they might, I'm not sure what they did, but that 90% are used less than one session. So
Got it.
they're
So
not
let's,
buying it. You gotta
well,
use the device.
absolutely. So let's talk about that for just a second. So you remind me of a conversation that I was having with a very, very famous exerciser. His name is Tony Horton. So people may remember Tony Horton. He made this cool program called P90X, right?
Yep.
You
Yep.
saw it on TV all the time, and he was exercising. He was doing all these things. I was very fortunate. I was in a lecture with Tony, and I raised my hand and I said to him, I said, Tony, I said, if you want to have an effective exercise routine, how many days a week should you exercise? He looked at me like I was crazy. He said, Michael, how many days a week do you diet? I was like, well, I watch my nutrition 7 days a week. He's like, that's the amount of time that you should exercise. And that's exactly what people should be doing with this. This is just like an exercise tool. This could be a barbell for your nose. You know what I'm saying? Like this is a whole Peloton for your brain type of thing. Like we're getting air in, but you got to use it.
Which then brings us perfectly to another component I want to talk a bit about.
Okay.
We understand this could, especially if we're marketing mostly on social media, that this could be gimmicky looking, right?
Yep.
You see it and you're like, it's too good to be true. All the things that we get all that, which is why Dr. Bogan, myself, as the inventors and founders of this, we searched out the top rhinologist in our area. He happened to be in the country because he's the president of the American Rhinological Society. He was in Charleston, just down the road from us. And I said, Dr. Schlosser, we need a study that proves or disproves that this thing is doing something.
Right.
And that study was published in the International Forum of Allergy and Rhinology. You can find this on our website. That is the preeminent rhinology journal. This is more than a lot of people want to hear, but I think it's critical. It was talk just a minute about it. That these were the patients they found had an average length of chronic congestion of just under 3 years. Most of them, 68% or so, actually were still on their steroids and their antihistamines. So these were train wrecks. Yet over 80% of them said, "Oh my gosh, it made me feel better."
So I've got the study right here for folks out there to have them understand this. So let's bring this point up and let's just lay it out on the table, okay? So people are looking at this thing and they're saying, wait a second, you tell me I breathe on this thing for 2 minutes, it relieves my congestion, and then I do it at night and it does it again. That does seem a little too good to be true. I totally get where people are coming from with this. So number one, people should know, and they should know me, right? So if you look me up, you'll see I've never worked with a product that doesn't have real data behind it. That's number one. I don't accept them. That's not my universe, right? And so to be fair, David and Dr. Bogan know this very, very well. Honestly, this thing has got more research behind it than I was expecting it to have. And the research itself, quite frankly, it was really well done and the results are ridiculously good. To the point where the first time I read it, I was like, come on, I want to see what's going on here. So here's what I did, okay? I put it on some patients because as a doc, I wanted to know, all right, I've been told this by my friends, I've read this in the literature, I've used it myself. Now I want to go the final step. I want to see what it looks like on my patients and get their feedback on it, right? Because quite frankly, it doesn't really matter if I like it. It doesn't really matter if it works on me. I got one, right? I want to make sure that other people get them and get this relief as well. So I'm going to tell you a story about 3 different patients that I've put this on just to kind of give you a little bit of a flavor of what's going on. So the first one was a young girl, 17 years old, chronic history of sinusitis, chronic history of all kinds of allergies. I mean, allergic to the pillow, allergic to the dog, allergic to the cat, like you name it, allergies, right? And very small girl, didn't snore, didn't have any sleep related issues, but was really getting congested at night and would tell me, hey, Dr. Breus, I need to raise the head of my bed up. I need to stack up the pillows just so that I can feel comfortable enough to breathe, right? That was her big issue. So I said to her, I said, I'm going to give you this thing and you got to use it. And she said, is it like a breathing treatment? Because she had had asthma in the past and she had done those nebulizer treatments and those breathing treatments before. And so I said, well, it's a little similar, but not really. The only similarity is that there's a little mask that's going to be on your nose. However, in a breathing treatment, it's usually a little bit more passive. You just kind of breathe it in and then breathe it out in a gentle format. This one's going to be a little bit more aggressive, more like an exercise, right? So we keep using this idea of this is an exercise for your sinuses. It is. An exercise requires effort. So I said to her, look, this is what I need you to do. Really push out with your, I mean, even do a whole neck thing if that's what you need to do to just be able to get used to it.
Don't hyperventilate, but you need to do it.
No. To be clear, you're not expiring all of your air, but you want to get that flutter that I was talking about earlier.
Right.
So she did, and it took her approximately 3 weeks before I was able to see her again. But she reported to me that within 6 to 7 days, she felt it was significantly different for her. So that was, number one, young 17-year-old female. Next, I stuck it in somebody who did not have apnea, but did snore, okay? So that one was an interesting one for me. So we knew that they did not have apnea. They were safe in that realm. We had them tested, but they did have snoring. Now, the snoring wasn't unbelievably loud freight train kind of snoring. It was little bit on the lighter side, but it was definitely something that was upsetting the bed partner, okay? Yep. Now, to be fair, I have a snoring bed partner, but it's my dog. And I haven't found a mouth guard yet or nose piece yet to put on my French bulldog. So I'm waiting for that one for sure, David. Yep. But for this one, this gentleman, we used it for him. And in approximately 10 days, his partner called me up and said, thank you, right? He's not snoring like he was before. Now, there was some breathing, still a slight heavier breathing, but the snore itself had really reduced, primarily because of all of this congestion that had been stuck up in here. And then the final one that I did it on, and this one, I do not recommend that people do this unless you talk with your doctor. So I want to explain that first. So I did this one in somebody with mild sleep apnea who was actually on a CPAP machine, okay? Yep. And the reason I did this is because people with mild sleep apnea, to be honest with you, they have a difficult time. If you have rip-roaring sleep apnea, stop breathing in your sleep 30, 40, 50 times a night, when we stick a CPAP on you, it works like magic and people love it. But when you have very mild apnea, like 5 to 10 times an hour, when they put a CPAP on you, it's not like magic. It's like torture half the time. So my goal was to see, could I make his CPAP more tolerable? Because my concern, my hypothesis was it had to do with congestion in his nose. The good news was, we worked with his doctor and he did have significant congestion in his nose. We had him use the SinuSonic. This one took a little bit longer. It took 3 to 4 weeks for us to really see any differences there. But the difference that we were able to see was he was able to tolerate his CPAP significantly longer at night, which meant he wore it longer. And he reported the next day that he felt better. Now, we don't know if he felt better because he had less sinus problems or he was able to use his CPAP longer. Quite frankly, I don't care because he felt better. Right? But those were 3 examples of patients that I put this on because, again, it seems like it's too good to be true. It seems like it's not going to be making any sense. But at the end of the day, we've got real science. We've got published literature. We have patients who have tried this, and we've got doctors who are advocating for it. So it's definitely something to think about and potentially try.
The thing that got the sinus docs in the study, obviously the questionnaires, how did you feel, and all those were fantastic and they recommended, but they actually did something where they measured airflow in this study. Right. And after first use, they measured a 15% increase in airflow. So not somebody had to feel, Michael, but it was truly, right, let's measure the air coming out of your nose, and it increased 15%. That was intriguing. But absolutely, more intriguing was after 2 weeks of use twice a day, that number increased to 31% increase in airflow. That's more than surgery in often cases. So it's not too good to be true because you can try your SinuSonic. It's not hard to try. one last thing before, and then I want to get to some sleep questions because some of them are related. Some of the things
Sure.
you hit on a few of them now, so that's a good thing. But one other just issue we run upon is why does it not? Why can't it be recharged, and why doesn't it last forever? And I will tell you, it's not a business model to make everybody buy more, but it really is a safety hygiene one. The docs originally, by the way, required us to make it a 60-day unit. While the study was being done,
Right.
it was a 60-day unit. And obviously, once the study was published, they looked at the safety data and other information, and they let us reconfigure the device. By the way, a lot of our negative Amazon comments are also, it's 60, only lasts 60 days. Well, it lasts 6 months. You get the bag, but not unlike your toothbrush, it needs to be replaced. We
Yeah.
have a recycle program that gives you great discount, but at the end of the day, it really does need to be replaced. And so I don't know if you know have to have any thoughts there, but it's just one of those sort of nagging things. We don't want to make everybody buy another one, but until there's you can't just put it in the dishwasher. You can't.
Right. Well, there's lots of reasons why it would make intuitive sense that we would want to replace the unit itself. Number one is it actually has a very particular frequency that it hums at. And so that's part of the unit itself. So that in and of itself becomes important. Also, when you look at this nose piece here, we want to make sure that that is something that doesn't have bacteria in it. Of course, down into the unit itself, you're pushing out warm air out of your lungs. Again, perfect breeding ground for bacteria, not
so
what
one
we
of our
want.
questions is can I share this with my bed partner?
So here's the truth of the matter, all right? I guess you could, but I wouldn't want to. Do you share your toothbrush with your bed partner?
Yeah.
I certainly don't, and I kiss that person,
So
right?
from the SinuSonic instruction man, we would say no, you should not share. You're given the will they do it anyway?
I
No.
hope not.
Sure.
Here's the other thing, to be fair. We're in the middle of a pandemic right now, right? And so sharing these types of items makes zero sense in my mind, right? And so everybody should have their own individual unit, I would argue. Also, it'll be important because what you don't want to do is be looking around for it. I like to create a habit. And so my habit is it sits right next to my toothbrush, and I brush my teeth, and then I do my SinuSonic, and then I do it the same thing at night. And look, I change the heads on my electric toothbrush every 30 to 60 days.
Yeah.
So
mine sits in my bag next to my driver's seat. So in the garage as I'm going.
Oh yeah, so you do it on the way to work?
Not while you're driving. You want to be a
no.
driver, but plenty of times you can do it. So that's one of the reasons it's $49.95 for 6 months. It's not that expensive a device. It's less than any of your Afrins, or really even when we've done a comparison and looked at the saline pods and the things. Although I want to make clear too, people say, well, should I stop using my saline spray? Actually, our sinus docs think this will help the usefulness of your saline spray. So if we're getting 15 to 31% more air in there, why don't we think when we're spraying it's going to disseminate better? So we really think that's a synergistic thing.
Yeah, and I would argue that it makes intuitive sense to, again, make it a habit. It's just part of your daily routine. It's part of your morning routine. It's part of your evening routine.
So this is it okay to only use it at night? So you do it twice a day. I would tell you from experience, people tell us a lot of folks only do it about 15 minutes before bed. They don't do the morning.
That's okay. That's okay. Can I address that in a unique way? So number one, if we've got people out there who are watching this, who are athletes or who like to work out, I'm going to tell you something. This thing helps my workouts. And that's part of the reason why I do it in the mornings. Okay. So I work out I do breath work, meditation, and my exercise every morning. I spend almost 90 minutes doing all of this stuff. And what I can tell you is my performance is better in all three activities: in my breath work, in my meditation, and in my exercise.
Thank you for going there. You're, as the sleep doctor, we've got a lot of nighttime questions. but I don't think there's any doubt. Exercise-induced rhinitis, you get stuffy when you ski or you do whatever,
Absolutely.
is real. So people,
100%.
and the science behind, and you already hit on this, the science behind the importance of nasal breathing over oral breathing is also true. But if I get stuffy when I exercise, I can't breathe through my nose, so it's sort of a
Right. Exactly. Exactly. It's just important for people to think about it. Now, great question. Can you only use it once a day and will it still be somewhat effective? Yes, it will. So use it. Use it before bed. It will help you sleep. It will help you breathe. I love it.
A related sleep question.
Okay, fire away.
I use it when I go to bed. When I wake up in the middle of the night, can I use it again? And will that wake me up, making it difficult to go to sleep? There's a long question, but that I get it. That makes sense. What do you say about that?
So I think there are two ways that I think you could do either or. So number one, if you wake up in the middle of the night and you're congested, this will decongest you very quickly. What will happen is if you breathe back and forth for 2 minutes straight, it will become mildly alerting and you will get a small dose of what we call nitrous oxide, which can actually be helpful in clearing out that whole area. That's an important factor to know and understand. However, I have not experienced this, neither have any of my patients, where they're using this in the middle of the night and it keeps them awake. Yeah. In fact, I would argue that it does the opposite, that it allows them to breathe better, which will allow them to fall asleep better. So I would say, go ahead.
And you hit on this. And if it allows them to put their CPAP back on,
right,
when they're used to ripping it off and being done for the night, that little bit of, if it does wake them up a little, they're going to get benefit plus, double, triple by putting that CPAP back on.
No question about it. So yes, if you wake up in the middle of the night, can you use it? Absolutely. Will it be mildly alerting? Of course it will be. You're breathing, pretty aggressively for 2 minutes, but that doesn't mean that when your breathing returns to normal, which takes about 30 seconds, guess what? You can now breathe and it's much easier to use your CPAP as well as to go back to sleep. So I don't have any problems with people using it in the middle of the night at all.
So what about antihistamines and steroids and Afrin right before bed? They have consequences too, right? If you do those in the middle.
Well, they're all stimulants and they all basically turn your brain on fire right before you're trying to go to bed. Yeah. Last time I checked, this was air, okay? Air and sound. This isn't going to hurt you. This isn't going to stimulate you. This isn't going to do anything but help you breathe better. So in those instances, I would say those types of things can actually do the opposite. Now, I want to be very clear. If you are on a medication prescribed by your doctor, speak to your doctor. Do not change that medication because you're using this. But if you want to, bring this to your doctor and show your doctor what it is. If you'd like, we can give you information that you can give to your doctor as well so that they can learn about the advantages to using something like this.
So we're right at our time limit, and
are we? Wow, that was fast.
Yeah, it's fun. We're going to have you back. We actually were just exhibiting at the summer sinus meeting in Austin, Texas. One of the first live, it was great, COVID times, 400 or so rhinologists across the country. And a rhinologist in Pennsylvania, unaffiliated, uncompensated by us, presented our data, our study at the show, and we were completely bombarded with people that went, "Wow, tell me about this." So which was a lot of fun. So
always a lot of fun.
Let me say thank you, Michael, for joining.
Of course.
And a fantastic information. We're excited you're a user. It's fun to, there is a meditation component to when I do it. I don't know if you do too. It's
Absolutely.
sort of, it slows you down to take in some nice deep breaths, and guess what? That nitric oxide and things are working. So also, if you're listening, you have any questions, info@sinusonic.com is an easy place to send a little email. We've got some additional questions here that we will respond to. We didn't get to all of them, but I think we hit on a bunch of really good sleep and just device stuff. Caleb, any questions? You're in the office here listening. And with that, we'll sign off and not go far over a time. And Michael, have a great day.
No, thank you guys so much. And if people want to learn more about me or SinuSonic, head on over to thesleepdoctor.com, where I've got articles where I talk to people about how I've used it in the past. Or check out the SinuSonic website. We're all over social media as well. So if you want, tag us on social media, because you might see some fun things going on there also. So wishing everybody out there sweet dreams as well as clear sinuses.
Yeah. Thanks, Michael. All right. Bye.
Bye, everyone.